Hello, everyone. Welcome to Transforming Healthcare, enabling a digitally enhanced, data-driven healthcare presentation. My name is Elizabeth Boudreau. I'm a healthcare leader and executive advisor here at Amazon Web Services, and I look forward to showing you a little more of what we're doing in healthcare at AWS. Going to our founder, Jeff, we continue to stick by these three large ideas that drive our business: put customers first, event, and be patient. And ways we do this in healthcare is, as we think about going forward, how can we be data-driven and digitally first? So everybody's just clear and we understand AWS is the cloud computing arm of Amazon. We provide the customers with the broadest and deepest cloud platform. We have the most services and more capabilities within each service than any other cloud provider. And with AWS, customers can get the right tool for the right job that they want to get done. We deliver innovation to customers at the fastest pace. In 2011, we released over 80 significant services and features, followed by nearly 160, all the way up to over 1,900 in 2018, and continue to grow. We have the largest global community of customers and partners. We have millions of active users on our platform and tens of thousands of partners across the globe. And we're very proud to have the most mature cloud platform. As Andy Jassy, our CEO, says, there's no compression algorithm for experience. And that is especially true when it comes to scale, security, and performance. As we look specifically to our breadth and depth of healthcare at AWS, we've been at this for over 13 years as a cloud provider and over 7 years dedicated specifically to healthcare and life sciences. And on average, our customers are being exposed to people with over 21 years of experience. And we come from all different areas. We've been chief digital officers. We have clinicians like physicians and nurses or chief medical officers. And as we talk about this, the reason that this is so important to us and our customers is when we come to speak with you, we want to know your business and we want to be able to start solutioning right away and start helping you find what solves your pain points versus having you to tell us what your day-to-day life is. We understand what that's like. We've been there and lived it. And this large population of background allows us to help move your needs forward faster. And as I said off the top, we're customer obsessed, and customer obsession goes across the spectrum of care. Often we think about the provider systems and hospitals and laboratory, home health and pharmacies, or the vendors in this space, the integrated service vendors, diagnostics, medical devices. But we know government is involved, public health, country-level ministries of health. They also may become payers, such as health plan or employers. And then there's our nonprofit health and research organizations. But no matter what perspective you're coming from, in the end, it goes back to patients. And being customer sense is looking at patients and looking at that human connection that is healthcare and how we can support and make that better. And we do this around the world. We have over 1 million active customers and across 190 countries. We continue to offer more regions and availability zones to meet our customer needs where they are and however they need us. And as we think about global, we want to make sure that no matter where you are, where you need our services, we are focused on the security and compliance. We have over 50 global compliance certifications and accreditations. For example, HIPAA on AWS, we now have over 100 HIPAA eligible services. We've focused on high trust and have over 60 high trust certified services. And all of our services are GDPR compliant. As new additional services release, as well as additional compliance, we continue to stay up with the market to ensure that the work you are doing is available and secure as you need it to be. We're working with some of the best in the world and we continue to engage. We look forward to working with more people, but examples of some of our customers are in the payer space, some of the providers, continuing to see expansion in our customers from startups all the way through to large institutions. Academic medicine continues to run and research with us, and we continue to support large whole governments and whole countries as we work to help improve healthcare around the world, no matter how you fit into the ecosystem. As we continue to create offerings, we've launched our AWS Marketplace. This is a great place where customers can discover thousands of product listings. In addition to that, we have over 230,000 active customers using this, and we have our own healthcare and life sciences marketplace subsection, looking for what services and what we can provide specifically to our customers. We've continued to add to our marketplace offerings and increased to add a machine learning model marketplace. Right now, there's at least 45 listings out there to find out if you can find a model that supports what you want to do, as well as if you create a model, it gives you the opportunity to post it and share or sell to others. Different ways models can be used include having data put in and providing a response, or providing the data for the model for somebody else to continue to build upon. There's multiple ways to solve a problem, and we want to collaborate with our customers. Additionally, we've launched the AWS Data Exchange to provide a secure and efficient distribution channel for our customers. Healthcare relevant data sets, de-identified data sets, and open data sets are available. We're launching with over 130 data listings, and it continues to grow. This allows access to data that you may not know existed or had access to before. We want to help accelerate your work, your research, and your care. And as we look across the broad spectrum to enable digitally enhanced healthcare, we see three large categories: assisting in IT cloud transformation, predicting healthcare relevant events, and then personalizing the healthcare journey. And I'd like to drill into each of these areas. Starting with the IT transformation, we want to dig into deeper of why we see IT interested in the cloud. 84% of provider organizations say they lack a reliable leader for enterprise security, and just 11% say they plan to fill a cybersecurity leadership position. This survey conducted by Black Book included responses from more than 300 strategic decision makers in U.S. healthcare organizations. And while all in might not be the strategy you're looking for, AWS and partners are deploying hybrid IT solutions and transitioning from data to information that's usable throughout a healthcare continuum. We're looking to support and keep our customers safe, as well as support them as they may grow in their healthcare journey and define new data types and need to store them in things such as data lakes. Hybrid IT infrastructure, such as our Outpost offering, allows you to bring the cloud to you in a way that you never have before. And the use of the cloud allows for transparency that you may have never been able to experience. And it makes that difficult problem of data wrangling and inventory much more cleaner and available and transparent. If we look at how much data people are moving to the cloud, a great example is Philips. They're storing petabytes of PHI in the cloud. As they set up their Trinity Cloud Beam on Redshift, it took less than 1 minute to load 37 million health records. And it took less than 1 minute to upload and get them up into the cloud. We want to store and optimize these data sets. We want to be able to get them quickly to those consultants and analysts who want to provide solutions to customers. And while they're housing around 33 petabytes of PHI, it's growing at about a petabyte a month. This is a size and scale that we've never seen before. But for us, it's really important to think about not only what you can do individually, but what we can do as a whole. And as we start thinking about that, we really want to think about interoperability. Interoperability is that ability to have different information systems, devices, applications to all connect in a coordinated manner within and across organizational boundaries. That's going to allow us to access, exchange, and cooperatively use all of this data amongst our stakeholders. Ultimately, the goal is optimizing the health of our individuals and populations. Fundamentally, a patient-focused initiative was designed to enhance patients' access to their medical records and support clinical decision makers that influence their medical outcomes. Change Healthcare's looking to eliminate cross-prohibitive barriers that have hampered open interoperability. And we want to accelerate that healthcare data interoperability, reducing providers' burden and reducing the time and effort needed to track down patients' medical records from various silos across multiple healthcare delivery systems. And Amazon Web Services has been honored to work with Change Healthcare to really work throughout this and the Commonwealth Alliance to move it forward. And if we look at communities, how do we exchange data within our communities? Greater Lakes Health Connect is deploying HIEs on AWS to connect 120 hospitals and over 6 million records. They continue to send 2.4 million messages a day, such as lab results and requests across the network, but really it allowed them provision new IT and get it ready for testing, and that didn't take months, but days. We want to leverage what the spend on IT to drastically do more than what we thought could be possible from their IT manager, Barry. They're seeing the art of the possible become the art of the now. And speaking of the art of the possible, it's really amazing to start thinking about what we're seeing in analytics, artificial intelligence, and machine learning. We're starting to baseline and measure quality initiatives with real and sophisticated data. We're starting to predict both clinical and operational improvements in our organizations. We're trying new things. Machine learning is new and that experimentation is exciting. And we look forward to seeing what our customers can do with that. And finally, we're deploying models to augment physician workflows and their workloads. We know there's a problem of physician burnout, and we want to be part of the solution. As we look to large organizations such as Cerner, which has stated that Amazon is their preferred cloud provider, we look at a really great opportunity we have with them around population health and their Healthy Intent platform. They're looking at 223 million person profiles, almost 20 petabytes of storage, large amounts of data connections and processing nodes. But the really great thing is changing the length of time it takes to do things. Instead of taking months and longer, we're getting into weeks or less. And that makes a difference in a population to make them healthier and sooner by getting that data together, getting it processed, and making it available. Orion Health is looking to use AWS's global infrastructure to scale. They're supporting 15 countries around the world. And with Amadeus on AWS, a single healthcare provider, such as Orion, can process more than 2 million patient messages a day. Again, this is about making data available where it needs to be, when it needs to be, at whatever level and scale it needs to be. When we start thinking about operational efficiency, it's a really great story from Beth Israel Deaconess Medical Center in Boston, Massachusetts. They wanted to start looking at a problem they had. How can we optimize the scheduling of 41 ORs? They started as a research project using machine learning to optimize schedules by aligning the schedules to improve patient flow and inpatient. Another thing they started to look at as a project was to leverage machine learning to improve the flow within operating rooms. Now, pre-surgical documentations packages are scanned as images, processed with TensorFlow on Amazon SageMaker, and hosted in Beth Israel's secure AWS cloud. The machine learning-driven process automatically recognizes and inserts consent forms into corresponding electronic health records, saves hospital staff hours of manual work. Beth Israel built a model that scans EHRs to look for key elements, such as a completed consent form. And if a consent form isn't found in the search, a signal appears, and it allows a nurse to follow up with those patients. By being able to follow up those patients, they're increasing their rescheduling, they're increasing their patient throughput, reducing their OR scheduling by 18%. But really, an outcome that's so important is improved patient and clinical satisfaction. No longer do you have to be the patient who's been on MPO with a last-minute cancellation because a form wasn't completed. They're being proactive and reaching out. Additional projects they've done is proactively reaching out to patients who are likely to miss appointments, which improves the patient experience and outcomes in a clinical setting. Future projects that they're looking to do is assess the overall risk of ICUs and predicting when the hospital will experience unexpected high volume of incoming patients. For example, Beth Israel's emergency department typically sees a surge of patient visits during the middle of the week, which can strain hospital resources. By looking at overall risk, they can better resource to manage the population. Another way we're working with organizations is GE Healthcare. We're revolutionizing healthcare with AI and analytics on their platform called Edison. They're looking to get greater efficiency, improve patient outcomes, and increase access to care. Edison invisibly augments workflows to make sure we deliver the most personalized patient care possible. It's an intelligent platform. It captures data from all the hospital systems using smart devices and intelligent apps. It's then curated and transferred into useful insights to inject back into devices and workflow. The first application is medical imaging. Due to scarcity, accuracy, timeliness, and cost, there's just not enough radiologists to manage growing populations. GE Healthcare set out to build an application platform that uses AI and ML to help supplement radiologists and allow them to make more accurate diagnosis more quickly and cost effectively. They ingest data using AWS resources, curate the data, and then train it using train the data using Amazon SageMaker and database migrations, and finally can deploy those algorithms back to the devices using Amazon CloudFront and SageMaker. We are not replacing clinicians, we're augmenting them, and we're giving them superpowers so that they can use what they know most efficiently for better care. One of the problems we see in healthcare is the massive billions of unstructured medical documents that are created each year. These documents have critical information that's just trapped from the availability of many of the providers, and then makes it very difficult to extract insights to improve patient care. Some of the services Amazon has done to help improve these is one, Amazon Transcribed Medical. We've enabled medical transcription via a microphone, collecting the voice, listening in through an API and an auto stream, and taking that stream of text and taking that stream of voice and turning it into text. That text can then be used by records, it could use downstream, but it no longer is stuck in a voice file or a blob. If we look at medical images, Amazon Recognition can help with labeling data, and you can provide custom labels through a console to make labeling your images fast and simple. You can automate machine learning on top of this to include auto ML capabilities so that the machine learning is working for you. And then as we wrap it up, simplifying model evaluation so that we have inference and feedback. We want to make sure that your model is performing and that you can do comparisons of prediction versus what label was actually assigned. The most exciting part of all of this is no machine learning experience is required. Our AI ML mission is to put machine learning in the hands of every developer, not every PhD in data science, but every developer, and bringing it down to usable. Another way we do this is looking at medical forms and using Amazon Textract. We want to be able to use OCR technology to quickly extract data accurately from documents, eliminate manual efforts of retyping, and lower that document processing costs. So the OCR, optical character recognition, can do detection, can look at key value pairs, tables. You can set the confidence threshold. A clinical care versus a researcher may use a different threshold on what they're willing to accept. But again, no machine learning is experienced. We've seen organizations, Alfresco, Cox Automotive, and Roche use these to build out information from pure data. Then we move on to how do we understand this data? Amazon Comprehend Medical is a natural language processing extract to take that medical information, again, that data with high accuracy, and help us turn it into information usable. Through multiple different APIs, either our medical named relationship or our PHI one, you can find entities such as medications, test and treatment, or relationship. Not only the medication, but what about that medication? What's its dosage? Not only what test was ordered, but what was the result, and tying them together. And finally, traits. It's not only important to know you have something, but if the note or the record says no longer has, that is just as important, especially around diagnosis, signs, and symptoms. What I love about this HIPAA eligible service, it is stateless. Amazon does not store any customer data. It merely runs through and returns a response. This is important because we are not building our services based off the data of our customers. This is a security feature. We don't need to know that. That is your data. You own it and you've protected it, and we are here to support you. We're distilling this very complex process down to a simple API call. So what does this look like? An example of a document, you may have a problem list, review of systems, different things of that. So when you run it through the API, a visual response to demonstrate is highlighting what things are, what are demographics, what are disease indicators and symptoms and diagnosis, and finally, what are medications and the information about that. Now that information, once it's highlighted and confidence scored, can be used in the next stage of putting it together. Again, the idea of changing this idea of not just having data, but turning data into information. We can have those text and medical images. We can have those scanned documents. We can have medical transcriptions. We can run them through Comprehend to pull out the data elements, store them, and then use them in secondary purposes, such as relational databases, ad hoc queries, and search. So who's done this? What's the point? The point of is our patients. Fred Hutch was one of our first partners as we started launching these services. And as Matthew Trumbull, their chief information officer at the time, said, curing cancer is an issue of time. We need to make sure that we are solving for this problem. And the process of developing clinical trials and connecting them to the right patient requires sifting through mountains of unstructured clinical records and data. Comprehend Medical reduces this time burden from hours to seconds. That's important. We're reducing time. And the faster we're getting patients into protocols, the faster we're starting to work on affecting lives. And as we think about all of these services in our AWS machine learning stack, starting at the top with our AI, these are meant for developers to easily access and use. We can go deeper into machine learning, and that is moving us into SageMaker and helping us build out machine learning developers and data scientists who want to build and train and deploy machine learning models. And finally, at the bottom, these are the frameworks and infrastructure. These are for the expert practitioners. So we have everything along your skill set to support what you need to do to get that kind of data. And once you have it and you have data and information, the important thing is, how do we bring it back to the patient? How do we personalize that health journey and engage people along all the way? We want to modernize how we interact with the healthcare system. We want to create digital therapeutics to solve, but we also want precision medicine to meet the bench to the bedside. MedStar Health went about to look at how they had their patient engagement portal. And when they moved to AWS, they combined 102 websites with a single destination. Well, that helps clarify use. It also helps the organization. They eliminated downtime a month. They decreased times for the page to load, but it created a platform for growth, and it helps them think about being a digital healthcare leader. They want to create mobile, social, and web services to improve every aspect of the healthcare experience. As we start to think about AI and conversational interfaces, think about Alexa that may be in your home. It's a cloud-based service available to millions of devices throughout the population. We also have Alexa for Business. So this allows business applications and management of devices within your organization. Examples include allowing employees to join meetings or get information, or we've seen them even to use them as to report issues. And finally, we have Lex. If you take Alexa and take the A's off each side, you end up with Lex. This is our AWS service that allows you to build conversational interfaces. And this can be both voice and text-based if we think about chatbots or voice recognition. So we are able to meet you with where you are, what you need in multiple different ways. John Brownstein, the Chief Innovation Officer at Boston Children's, launched My Children's Enhanced Recovery After Surgery Skill. And ERAS allowed patients and caregivers to share recovery process with their care teams post-surgery. And he talks about the strength of voice to extend the care and support to their patients when they're no longer in the four walls of the hospital. If we look to the UK and the National Health Service, they're turning conversations into insights. The National Health Service is UK's largest employer and health provider, and the Business Service Authority is a special health advisory that is providing a range of critical central services to NHS organization, NHS contractors, patients, and the public. The BSA has 450 call centers, staff handling around 5 million calls per year, dealing with a whole range of routine requests for information, especially around the European Health Insurance Card, and the response time started to lag. They began to route incoming calls through Amazon Lex-enabled chatbots, which understood natural language and intent without requiring callers to use specific phrases, and reduced call center load by providing simple answers to information, to advice and guidance on the EHIC. It allowed them to reduce call volumes by 40%, and identify approximately $650,000 per year in cost saving while reducing wait times for callers and improving the caller's experience so that the staff at the call centers focused on the calls that really required the human interaction, not the simple, repeatable questions that came up. But what was really amazing is how fast this happened. They deployed 2 weeks ahead of the EHIC rollout and were able to increase the public service to a 24/7 offering. This is changing the way we think about operations at health systems and at levels that are countrywide. We want to move beyond these platforms and texts and think about digital health beyond the pill. So we have things like Pear Therapeutics are using behavioral therapy to help patients overcome substance abuse. We have digital pills. We have Propeller, which is helping asthmatics think about IoT-enabled devices, as well as platforms and machine learning and analytics to help them live healthier lives so that they're not showing up in emergency situations. Omada is looking at high touch to patients via high tech. So they're using a diabetes prevention program with mobile and web apps specifically focused on type 2 diabetics and looking to lower their risk of type 2 by 30% in 12 months. They deployed for over 120,000 participants, and they're seeing a net value of $2,000 savings per participant for their health plans and employers. And finally, we want to think about getting from the bedside to the bench, from the bedside to precision medicine to our patients. And examples such as American Heart Association's precision medicine platform is looking to get all of that data, create cohorts, and allow this gene expression data to use precision medicine, find answers, and improve care. As we look across the spectrum, we're trying to unlock these insights to enable this data-driven, digitally enhanced healthcare, be it from the beginning all the way through the deepest end. AWS has a commitment to create enterprise-level solutions for healthcare customers and can help you transform your operations at each point in the value chain. We look forward to being your trusted provider and help accelerate transformation to unlock insights to drive better healthcare. Thank you for joining me today to better understand how AWS is transforming healthcare. We look forward to continuing to collaborate with global healthcare industry to build innovative, cost-effective, and secure solutions that improve operational and clinical effectiveness, while in the end, doing what's most important, improving patient outcomes. To learn more, visit aws.amazon.com/health, where you can get access to content, chat with one of our representatives, and request more information. Thank you.